So then the next stage is REM, right? That's we go into what's called theta wave. And that is where we do our mental and emotional processing, right? Outside of meditation, that's the only time we get it.
Dr. Shirazi, I'm so excited that you are here with me on Staying Ageless. Thank you so much for joining us.
Thank you, bra girl. I'm happy to be here.
So I found your background super fascinating. Like I go down these nerdy sort of like health rabbit holes where I start studying different things, but I'm like, what? A dentist? And then he studies Oriental medicine. And then he's a sleep technologist. I mean, this is like really cool. So can you kind of give us how did this all happen? Was this by design or was it kind of like you were led to different things?
Yeah, I was led to different things. It was one of those things of I didn't choose my occupation chose me from passion.
Yeah.
So my mom's a dentist, right? And she inspired me to be a dentist. And I always knew, I think I was 14 or younger when I knew I wanted to be a dentist. I'm watching her do root canals and I'm thinking, this is the coolest thing ever, right? And I love working with my hands and I love people. So chatting people up was easy and fun for me. And when I was 18, I had a cold and my mom told me to go to the doctor. And so I go to Kaiser and there's like this huge room filled with people hacking and coughing. So I went home. I came back an hour later. They brought me in and they gave me antibiotics. And my whole family is like doctors and dentists. So I was like, okay, so what is this antibiotic going to do for the virus that I have? And the guy's like, well, the antibiotic will focus on the bacterial bugs in your system so that your immune system can focus on the virus. I said, okay, I'm 18. I'm like, okay. I tell my mom what he said. And my mom was in that age group of, whatever the doctor tells you to do, you got to do it.
Right,
I was like, okay.
Right.
So I took it. I got better. And I was a nerd and we didn't have internet. So I literally went to the library. I looked it up. And even in 1991, we knew that you don't give antibiotics for viral infection. There are side effects for that, right? So
Yeah.
I literally just told myself, these people are friggin' useless. It was literally my thought. And so I decided that, okay, after dental school, I'm going to study something more holistic so that when I have a family, I can care for them better than these idiots, right? So when I was doing martial arts, I did Shaolin martial arts. My instructor was a dental technologist in the Army. And he's like, Dave, you have to look into acupuncture. I said, okay. I called the school up, told them my intentions. And they're like, the secretary's like, let me give you the dean. I was like, what? And the dean picked up and he's like, oh, thank you. And whenever you're ready, I'll give you a personal tour of the school. They were so welcoming. I loved it. So I graduated dental school in 2000. I went to Howard in Washington, D.C.
Yeah.
Loved my school. Couldn't wait to come back home to California because I do not know why people want to live in Washington, D.C. or the East Coast in general. Like New York is the worst, in my opinion, to live. To visit, cool, right?
Right.
But to live, forget it. And to me, like D.C. is like a New York light,
Right.
And I came running back to California. I graduated in 2000, and January 2nd of 2001, I was enrolled in a master's program in Chinese medicine.
Wow.
And I had no intention of finishing the master's. I had no intention of practicing acupuncture. I just wanted to learn as much as I could. And I was learning. And they would say like, oh, you can cure this with herbs and you can cure that with acupuncture. And I remember thinking like, okay, dude, come on, just take it easy, right? And then we got into the clinic. The last year or two I was in the clinic and I watched like the most skeptical people come in, like Vietnam veterans that were like, listen, I'm only here because my daughter had a coupon. And I love my daughter, and she's been bugging me to try acupuncture. And I'm like, okay.
Right.
And I was even intimidated. I would tell my teacher, like, can you do it? And this guy's already, And the patient would have tremendous relief. They'd be like, they have shoulder pain for 40 years. And they're like, you know what? it's not 100% gone, but it's almost 100% gone. This is amazing. And my
Hmm.
eyes were just like wide open looking at this.
Hmm.
And while I was in the clinic and watching the clinical application of acupuncture and herbs, I was doing orthodontics, what we call functional orthodontics, and this TMJ therapy. And then I
Hmm.
thought to myself, well, what if I combined this whole acupuncture and, you know, TMJ appliance therapy
Hmm.
together, right? And I
Mhm,
did,
mhm,
and it was hugely successful in terms of, you know, patient outcome. And I have to say, it was I've always loved dentistry. Like, I think it's awesome to be a little contractor and work on these little teeth and do all these architectural things in a wet environment on a live patient. It's kind of cool.
mhm.
But getting someone out of lifelong migraine,
Hmm.
getting someone to sleep through the night and get their life back, having the child no longer have bedwetting and ADD and ADHD, which were all the things I had as a kid. And now they
Mhm.
get to like function in society and you know, that to me was way more rewarding than doing the dentistry.
Mm.
And and so that's what I did. And then as soon as I graduated acupuncture school, I opened up my center, and then I decided to get a master's in psychology, and I did that again for myself. I wanted to work on my issues so that when I had kids, I wouldn't pass down all my childhood stuff onto my poor kids, right? you
Right.
know, that was again selfishly reasons, right? But you're not the same person after you do that, right? It
Mm.
affects every aspect. The way you look at the world changes, you know, the way you look at yourself. So it all just sort of happened. And then about, what was it, about 7 or 8 years into my practice, I had moved to a bigger facility,
Mhm.
and it was a soft shell. Like, so we built it out the way we wanted. And when I did, uh, I had gone to these conferences, for these sleep technology conferences, and I asked the guy, I go, hey, can I become certified as a sleep technologist? He goes, oh, great. You want to own your own sleep lab? I said, no, no, no. I just want to show the doctors around me that I didn't take a weekend course in this. I'm the real deal.
Right.
And because there is no specialist in dental sleep medicine. I'm board certified, but that's not the same as specialty.
Mm, mm.
So so he kept pushing me. He goes, so you want to open up your own office? I go, well, are you soliciting me? And he goes, kind of, yes, and I just remember on the flight home, I was just thinking to myself, I refer these sleep labs like 10 studies a month at least. And
Wow.
maybe they send me one back, right? And I know half of them can't handle the CPAP. So something's wrong with this, right? So I said, what the hell? What do I got to lose? My one referral? You know?
Right.
So I did it with the intention of focusing on research, which is what my sleep lab is based upon. Um, and then just so you know, I never renewed my sleep technology license, so I'm technically no longer a
Okay.
sleep technologist. But I mean, as you know, for every license, you have to do 50 hours of continuing education every couple of
Yeah.
years. That tends to add up when you're running two practices and have to manage staff and,
Of course.
and overhead. So I
Of
was
course.
fine with not renewing that.
Okay. Okay. So what are the links between sleep and dental health? Because when I think sleep, I don't think of dental health at all. And I think people really do need to know about this.
Yeah, so there's a lot actually. So there's not one aspect of our health that sleep doesn't affect.
Mm.
There is not one disease that is either directly or indirectly compromised or made worse by compromised sleep, right?
Mhm. Mhm.
So when we talk about sleep and dentistry, we're talking about obstructive sleep apnea, snoring, things like that. And that has been associated with gum disease, increased cavities, clenching
Hmm.
your teeth at night, which then leads to TMJ disorders, which then leads to tension type and migraine type headaches. Um, it's quite a well
Hmm.
of it. It's quite the rabbit hole once you go down it. I was shocked myself. Like, I had very little training in orofacial pain in dental school, and as most dental schools have very little training. And I remember when I started to get into this, I had heard about the American Academy of Craniofacial Pain, and I went to one of their annual conferences. I was doing about 200 hours a year of CE back then. And when I went to one of their conferences, I couldn't believe it. It was shocking
Hmm.
how, this whole new world, like, they were talking about things that seemed to have nothing to do with teeth.
Right.
And I loved it. I loved it, and it seemed like more opportunity to incorporate the Chinese medicine into being able to help people through the mouth. So it's a very, very interesting subject. I'm delighted to be doing it. I absolutely love it.
So there's basically, it sounds like basically things that are going on in your mouth can then lead to obstructive breathing patterns, which could
Well,
lead.
so sleep. Let me first answer your question about how it affects your mouth. So
Mm-hmm.
if you have sleep apnea, it's very,
Mm-hmm.
very common that your mouth breathing instead of nasal breathing. Okay,
Mm-hmm.
so that is associated with your saliva being dried up. When your
Mm.
saliva is dried up, it doesn't wash out any of the residual sugars from the last meal you had at bedtime, which means
Right.
cavity city, right?
Right.
And then it's also, it doesn't keep your gums moist. Your gums are made of the same material as your skin, but they're
Mm.
pink because they're more vascular. Okay.
Mm-hmm.
And
Mm.
then it's also associated with clenching your teeth. So then now you have these dried out teeth, which
Mm-hmm.
when you mouth breathe, you are collecting dust, right? So now
Mm-hmm.
you have a dry mouth with grit on it, and then you're clenching,
Mm.
right?
Mm-hmm.
So that whole world is its whole. I mean, I could stay busy if I just did dentistry associated with sleep apnea. But sleep apnea itself is compromised neuromuscular tone, right? So if you ever see like a really buff guy who works out a lot, when
Mm-hmm.
they wear like a muscle shirt, when they're relaxed, they look
Mm-hmm.
like they're flexing, right? That's because they have a strong basal muscle tone. Okay. When we have a weak basal muscle tone, it's very easy for the muscles to collapse. Okay. So imagine you're sleeping on your back, and now the soft tissue of your tongue, your prepharyngeal muscles start to collapse a bit more, right? And there's also something called the Bernoulli effect, which is when you have the same volume of fluid or air
Mm-hmm.
going through a smaller hose, the water is accelerated or the air is accelerated, right? But when it's accelerated, as it's accelerating through, it sucks in the walls, right? Sort of like, so when you're holding a garden hose and you're trying to get the grass at the end of your like lawn,
Mm-hmm.
and you'll pinch the hose to make it go farther and faster, but if you pinch it a little bit too much, it'll just close right up,
Mm.
right?
Mm.
So
Mm.
it's one of those diseases that the worse it gets, the worse it gets. So it's associated with weight gain, and it can make you more hungry even though you don't need the calories. And then you eat, and then you become more fat or more swollen or have more edema, which then makes more weight for that basal muscle tone to resist against, which collapses more. So I hope that explains it.
No, it does. It
Mhm.
does. Um, can you take us through the stages of sleep?
Yeah, I'd be delighted. So stage one we call alpha. It
Mm-hmm.
is a relaxed mental and physical state. So every time we close our eyes, we go into alpha. Okay, even when we're wide awake. Okay, and it's a very basic, segue into deeper stages of sleep. And then we get into stage two, which have these very weird patterns on the EEG called K complexes. And that's, believe it or not, that's the stage of sleep we know the least about. And then we get into what's called delta. Delta stage 3. When we had stage 3 and 4, they were both Delta. But Delta is where we get almost 100% of all of our growth hormone. During that one stage, we get almost 100% of our growth hormone. And I always find this fascinating where there's these people on Joe Rogan's podcast that'll say, if you fast for 3-4 days and then, eat a muffin and have a cup of coffee with butter and salt and fiber in it, you'll increase your growth hormone by 0.13%. Like, they're just so excited about these little gains, right? And I'm like, no, just get some goddamn good sleep. Okay, that'll do the most for you, right? And which is another reason why when children have sleep apnea, it retards their growth and physical development so much.
Wow.
In adults, we don't grow anymore, but we use the growth hormone to repair. Right? So then the next stage is REM, right? That's we go into what's called theta wave. And that is where we do our mental and emotional processing. Right? Outside of meditation, that's the only time we get it. Right? And I mean, that's how we handle stress. That's how we memorize things for tests. And now we're even finding out that our brains have its own separate lymphatic system. And during REM is when the brain is clearing out the beta amyloid plaques in the blood vessels. So it's a fertile subject, but it's like one of those things that the more we learn about it, the more amazed we are by it.
That's so interesting. I did not know that about Delta and growth hormone. So I guess I love it because as an adult, it's like if you want to repair, which also, translates to if you want to age well, because in order to age well, you have to repair.
That's right.
And you need to have that Delta phase, and that's right before REM. Right.
Yeah, it's right before REM, and then we cycle it out. Then we drop back down into stage 1, 2, then 3, then REM, then 1, 2, 3, REM. 1, 2, 3.
Is it 3 times it happens?
No. 5 to 6 times on average.
5 to 6.
Right? People that wait until after midnight to fall asleep will maybe get 4. More cycles, and we'll get more REM in the early hours in the morning versus. When we first fall asleep.
Is there a recommended amount of REM sleep to get? Now, I have all these sleep trackers now. I'm wearing my Whoop tracker,
I don't buy into any of those.
I was going to ask you if you were into them or not.
Well, I love the Aura Ring. I think the Aura gives pretty decent.
I like the Aura.
Yeah, pretty decent data. But again, if the device is not tested against a PSG, to me, it's worthless. It's just a gimmick. Okay, maybe slightly better than nothing. Like maybe it'll tell you how restless you are. Okay, because if you fidget in the middle of the night, that's you're restless. Yeah, and that also implies what's called an arousal. An arousal is when we go from a deep stage of sleep, like Delta or REM, into a lighter stage of sleep for 10 seconds or greater. Right. Okay. So, jerking around in your sleep is an anecdotal observation of a potential arousal. And arousals are the most important thing as far as I'm concerned, much more important than your oxygen.
What's PSG?
Polysomnogram. That's the kind of sleep study where you go into the lab, they put all the leads on you, thermistor, nasal, and we measure your parameters.
Okay. That's really gangster. So that's a whole nother level.
I'll tell you what, there is more data in a sleep study than there is in any blood test.
Wow.
Because we're measuring, there's like 20 leads on the person. We're measuring their brain waves. We're measuring their oxygen, their airflow, their clenching activity, their limb activity, their heart activity, their autonomic tone. I mean, these are huge. And then at the same time, we can look at, let's say, the heart rate variability and notice, well, what makes the heart rate variability spike? Is it the oxygen? Is it the clenching? Is it, what is it that's disturbing it?
No, that's cool. That's really cool. So what is it about early stages of life, in particular breastfeeding? How does that tie in with our teeth and our overall health. I mean, I ask this question every single time I see someone in my office. So breastfeeding, whether or not someone was breastfed is very important to me, but I
Mm-hmm.
for specific reasons. I guess I'm interested in from your perspective.
Yeah. So when we look at skulls prior to the Industrial Revolution,
Mm-hmm.
most people had nice wide arches. They
Mm-hmm.
had all their teeth. They were
Mm-hmm.
pretty straight
Mm-hmm.
without an orthodontist, right? They were pretty straight.
Mm-hmm.
And there was about that much space behind each wisdom tooth. That's how wide their
Oh
palates were.
wow.
And the palate is the roof of the mouth, but it's also the floor of the nose. So if you've got a nice wide palate, you've got a flat palate and a nice big base for your nose to breathe in, right?
Mm-hmm.
And their sinuses were very small. Their maxillary sinuses were very small. And we know that the average person prior to the Industrial Revolution breastfed for 3 to 5 years,
Yes.
right? And then they waited. I should say they didn't wait. As soon as the kid grew some teeth, they started giving him or her some food to chew on, right? So the chewing, the activity of the muscles, like gives us the ability to like have what's called a higher vertical, right?
Mm.
So we get
Mm.
more developed chins rather than a recessed chin. And then
Mm.
when we're breastfeeding, so if this is the roof of the mouth, imagine the nipple going inside the baby's mouth. Okay,
Mm-hmm.
the way the baby suckles the nipple is it presses the base of the tip of the tongue against the base of the nipple and makes a motion like this, which squeezes the milk down the throat.
Mm-hmm.
Yeah,
Mm-hmm.
and when the nipple is not there, then it swallows the same way, right? It's been taught how to swallow.
Mm-hmm.
Yeah,
Mm-hmm.
it's like muscle memory. And when we swallow the proper way, the muscle on its own does the palatal development. That makes sense?
Yes.
Mm-hmm.
So the actual beginning acts of breastfeeding, all that early chewing is literally laying the foundation for our entire, like I guess our way our face is wired, sort of, or
Mm-hmm.
like our teeth is wired.
That's right. So we have
Okay.
genetics and then we have epigenetics,
Yes.
which is what we're doing to express the phenotype of our genotype.
Mm-hmm. Mm-hmm. Okay.
Yeah.
Interesting. What is something about sleep that you know that you wish everybody else knew? You feel like it's not
All of
very.
it. I wish I wish people knew all of it. If people really knew how important sleep is, they would put it above diet and exercise. They would put it above, like, you always hear about older couples saying, you know what, let's never go to bed angry, right?
Yeah.
So, I mean, that's good for your marriage, but it's also good for yourself, right?
Yeah. Yeah.
Because if you can't process your upset from getting enough REM sleep, you're not going to come out of this good.
Yeah.
You know what I mean? Or you're not going to come out of this well. You're going to still be ornery about it. You're still going to have resentful feelings. And on paper, you might say, okay, yeah, let's sweep it under the rug. We're done. But then you're going to harbor some feelings.
Yeah. No, that makes sense. That makes
Mm-hmm.
sense. I always tell my clients that sleep is the foundation of healthy living. And
Mm-hmm.
so I can't help you lose weight. You can eat really great if you want to, blah, blah, blah. But it's going to, the sleep, not having that foundation also affects the way that we crave, the kinds of foods that we crave.
Mm-hmm.
So it can become this bad cycle. And then it's like also, if you don't have the energy that you needed from sleep, you probably won't exercise. And if you
Mm-hmm.
do exercise without sleep, it's kind of like, why? It's actually a stressor at that point
That's
because
right. It'll create
I'm not.
inflammation without your body repairing itself. Yeah.
Exactly. So it's like we need the repair as the foundation, and then we build all the other tenets of healthy living on it. So I'm completely in agreement, even though I'm not a sleep technologist.
Yeah.
Is there anything else that you can think of that is really important that would be link sleep to the way that we age?
Oh, well, yeah. So one, I talked about how the growth hormone repairs us.
Yes.
The mental, emotional health. I believe mental health is the most important kind of health. You got to have that first before you can have the physical, again, in my opinion. Um, and I think that's what we have a real crisis of in our country is we have a mental health crisis, and
Mm-hmm.
then we have a lack of access to care crisis,
Mm-hmm.
right?
Mm-hmm.
So it's
Mm-hmm.
very hard. I mean, insurance nowadays is almost worthless,
Mm-hmm.
right?
Mm-hmm.
And you work, you pay all this money to have insurance, and you want to go to the doctor, and they hardly cover it.
Mm-hmm.
It's a major problem.
Mm-hmm.
It's a major problem, you know. And once we have that, once we have proper mental health, then we can build on that and say, okay, well, I'm really going to be more mindful of what I'm eating, right? Because if you feel like crap all the time, if you eat crap, it's like you get this temporary like high, temporary enjoyment, and then you just go back to feeling like crap, right?
Mm-hmm.
Whereas if you have good mental health, if you eat some bad food one time, you can go, ooh, you know what? I don't think that chicken sandwich from KFC, hit me right.
Right.
And I think next time maybe I'll make my own sandwich,
Right. Right.
and then go from there. Not to pick on KFC. When I was a little kid, I worked there,
Right.
but just like any fast food place.
Okay. All right. Where can people find you online
Yeah.
and on the internets?
So our website is tmjla.com
Mm-hmm.
or tmjconejo.com. They're both really the same website for the same, two different locations, but I'm in both. If you go on Facebook and type in TMJ and Sleep Therapy Center of Conejo Valley or TMJ and Sleep Therapy Center of Los Angeles, there I am. My website has a lot of articles and a lot of information, so
Mm-hmm.
people can just look into that and say, hey, yeah, that's what I want to know about.
Cool. And what would you consider who are people that need to see you just so that they
Um,
are clear?
yeah, so you're on the sleep front, so if you
Yeah.
have snoring or sleep apnea,
Okay.
and you've either tried CPAP and you didn't like it, or you just know you don't want CPAP, right? We have to acknowledge that because even though CPAP works better than oral appliances, which is what I make, it's just not tolerated as well as oral
Mm-hmm.
appliances, right?
Mm-hmm.
So there's that. And then people with chronic pain. So if you have jaw pain, headaches, migraines, neuralgias, the kind of therapies that we do is very successful, and it's more holistic. It's non-surgical,
Awesome.
and tertiarily, if you want to have orthodontics done, especially in children, but even in adults, if you want to have it done without having teeth extracted, when your arches are developed, where we encourage the normal swallow with our appliances because our appliances take up such low oral volume. That would be how I could best serve people.
Awesome. Thank you so much, Dr. Shirazi. This was a great conversation.
Thank you for having me. This is fun. Thank you.